Hi, today I'm going to be talking about the physical growth of children between ages 3 and 6. Children in developed countries grow steadily and usually grow about 2 to 3 inches and 5 to 7 pounds per year. A typical 3-year-old is around 35 inches tall and usually weighs around 30 pounds, while by age 6 they reach about 45 inches and are 45 pounds. Children lose their baby fat during this stage and they start to look more adult like and retain more muscle. And the shift in their bodies is unfortunately slower in developing countries because of poor nutrition and higher disease rates. And these differences do remind us that how much environment and nutrition affect a child's physical development. Stunting means a child is significantly shorter than expected for their age, usually due to chronic malnutrition or an illness. Globally, there's about 23% of children under the age of 5 who are considered stunted. The rates are even higher in some other regions where malnutrition is more common and health issues are more common. Stunning doesn't just affect height, it also has lifelong consequences. It limits physical strength, brain development, and learning potentials. Children from low income families in developing countries are at the highest risk, but even within wealthier nations, socioeconomic differences can influence nutrition and growth. Genetics do play a role, but nutrition and healthcare are ultimately the biggest factor. By the age of 3, most children have their full set of 20 baby teeth, which will eventually be replaced by their 32 permanent teeth, which starts around age 6. Children may keep their baby teeth for nearly a decade, so learning proper care is very critical to prevent cavities and just get them in the practice of taking care of their teeth for when they do have permanent teeth. In developed countries, many children start visiting the dentist at around age 3, and they will get their first fluoride rinse and sometimes a protective sealant of some sort. Still, 30% of American children ages 2 to 5 develop cavities, especially in low income families. In developing countries, sugar intake is usually lower, but there is a lack of fluoride and limited access to dental care, which does cause a high decay rate. During early childhood, growth tends to slow, so appetite naturally decreases. Parents start to worry about their kids when they stop eating and aren't interested in eating and they basically are forced to eat. But it's really nothing to worry about and it's considered normal unless it persists long term and there starts to be issues arising. Um, And children's food preferences largely mirror the diets of adults. A lot of developed countries, like to say that kids only like chicken nuggets, mac and cheese, french fries, and it often becomes an issue where parents will just allow their kids to eat that, and that is why we have a problem with obesity and poor nutrition in our young children. And calcium deficiency is also common and it affects bone and tooth development, which is very important in these stages. And so, encouraging balanced diets really does help and affect them. In developing countries, illness and disease still remain the leading cause of death for young children because of the lack of health care that they receive. And they tend to get things like pneumonia, malaria, and measles, which their bodies aren't able to fight off by themselves. They need medical intervention. Malnutrition that they deal with worsens the problem because their immune systems are weaker. That in wealthier nations, the diseases are less deadly because of vaccines and better health care. And so accidents are actually the biggest danger. And young kids are energetic and they lack awareness a lot of times. So there is a bigger risk of falls, cuts, animal bites, or even drownings are very common. Boys are especially prone because of more rough play. And so, yeah. When a child reaches about the age 6 to 10, they grow 2 to 3 inches in height and gain 5 to 7 pounds per year. This is also the stage that they're the slimmest of the entire span of their life weight.